Hello, I'm Sharon Huner, and I'd like to tell you today about our project developing medical respite for people experiencing homelessness that requires cross-sector team collaboration and shared ownership. The background of this project is Buffalo City Mission, a nonprofit organization here in the city of Buffalo, opened a 13-bed recuperative care unit, which is a medical respite, in their brand new building with two clinics co-located. The first one was with Spectrum Health and Human Services, which is a behavioral health organization, and Jericho Road Community Health Center, which is a primary care. Both of those organizations had a clinic within the Buffalo City Mission building. The Buffalo Crossing Sectors Together Clinical Scholars team is a group of 4 nurses who worked collectively with community partners to develop a new cross-sector team. This diagram shows our sort of depiction of the wicked problem of coordination of post-acute cross-sector services for persons experiencing homelessness. So the background here is really thinking about in the context of a population of persons who experience homelessness after hospital discharge. Our team got involved with meeting with the Buffalo City Mission, the primary care, and the behavioral health clinics that were co-located there, and really engaged in trying to develop a structure that allowed us to collaborate together. And that included bringing in additional partners, including local hospitals, insurers, and the Visiting Nursing Association. So our methods, we started off with a 13-bed recuperative care unit, which opened in February of 2020. This was during the pandemic, and there were a number of problems with cross-sector staffing, as well as discharges from the hospital. Initially, what we did is start to have weekly case conferences, which were held over Zoom, and we focused initially on trying to develop a referral form, protocols, a policy manual, and that morphed into really talking about potential residents and current residents in the recuperative care unit. This meeting was really important as it facilitated clarification of cross-sector team member roles and identification of care needs, as well as the gaps in care for those individuals. A second group that we set up was an advisory board that met monthly in order to really approve all of the policies, identify potential problems that were occurring, look for new referral sources. And at one point, the board disbanded, and then reformed because we identified that there were additional structural barriers to care that were preventing us from really being as productive as we hoped to be. The first year, there were 25 recuperative care unit encounters serving 24 unique residents with cross-sector needs. And what the recuperative care unit did was provide these wraparound services. The outcomes that we were interested in certainly looked at readmission to the hospital and emergency room, but there were social care outcomes that we were particularly interested in, and these included things like the percent who transitioned to permanent housing, getting people established in community or faith-based support programs, and increased earned incomes for the persons experiencing homelessness. Our overall findings suggest that there was a new baseline for health and social programs serving this population in the region and beyond. And our key lessons learned is that it was really important to foster a diverse collaborative team so that we could come up with creative solutions that really incorporated everyone's perspective. We felt that consistency and continuity with the core members really was important to keep the project focused and moving forward. We also felt that when we made a shift to really thinking about shared ownership with active administrative buy-in, support, agreement, and enforcement, that propelled us forward in meeting our goals and in creating a greater structural solidity. And right now our exit plan is to support development of a sustainable, robust program. I'd like to acknowledge my colleagues in this effort, Deb Heigl, Donna Gaddy, and Amanda Anderson, and I would like to thank Clinical Scholars for funding this program, and also for Robert, which was a program of the Robert Wood Johnson Foundation. Thank you so much. Bye now.